Hello, hi dear friends. I am Dr. Gayatri PS, Junior Resident at the Department of Community Medicine. Here is yet another episode of Scientia, the public health podcast, an esteemed endeavor of health communication by the postgraduate students of Community Medicine, Pushpagiri Institute of Medical Sciences and Research Center, Tiruvalla. The goal of our podcast is to bring about a scientific temper on public health domains and to provide a regular platform of news and information. Today, we are honored to host Dr. Suptendra Nath Sarbadhikari, a distinguished member of WHO roster of experts on digital health. Dr. Sarbadhikari is a health informatics educationist and an independent consultant for digital health standards. He holds a medical degree from the University of Calcutta and a PhD in biomedical engineering from IIT Banaras Hindu University. Formerly the Dean of Academics and Student Affairs and Professor of Health Informatics at the International Institute of Health Management Research, Delhi, Dr. Sarbadhikari has played pivotal roles in various health projects, including serving as the first project director for the Center for Health Informatics of the National Health Portal. Additionally, he is a founding member of Health Level 7 Fast Health Interoperability Resources Foundation and have been an expert advisor for the e-learning advisory group of SNOMED CT. Dr. Sarbadhikari is the founder and director of Suptendra Institute and serves on the board of governors at the Commonwealth University College of Medicine, St. Lucia. Acknowledged as an IMA honorary professor, a distinguished fellow at HIT Lab, and faculty and fellow of PhD Foundation for Advancement of International Medical Education and Research, Dr. Sarbadhikari has an impressive record with over 70 publications to his name. We extend a hearty welcome to you to Scientia, sir.
Thank you very much, Gayatri, for the wonderful introduction.
Sir, there is great significance for digital health standards in today's healthcare landscape. Can you provide an overview of your role as health informatics educationist with regard to this?
Well, standards is actually very essential for, interoperability. If you think beyond healthcare, say earlier when we were globetrotters, we had to carry either multiple adapters with us or a universal adapter, something, because the plug points in different countries are different. So the plug plugs we are carrying for our laptops or mobile chargers, they don't fit into those. So we have to use those. But now we have got a USB connector everywhere, whether it's in the airports or in the metro rails, anywhere. We can easily charge our mobiles or laptops from any source. So that's the beauty of standard. So healthcare, what happens when we are trying to digitize it? In the digital form, if you want to exchange, unless they are in the same format, then it becomes difficult to meaningfully extract anything from it. Of course, interoperability has got various layers. First is the structural, syntactic interoperability. Then the next is the semantic, or the meaning. So for each of these, there are various standards. In fact, the Ministry of Health and Family Welfare had brought out the standards for EHR way back in 2013. August 2013, the first edition was published. At that time, we were not members of SNOMED City, but then India became a country member of SNOMED City in 2014 March. So subsequently, it was revised, the EHR standards, and in December 2016, the second edition came out, where SNOMED City was included. We had another upgrade when in 2019, the National Digital Health Blueprint was published. In that, another standard was added to these 35 standards. That was the HL75 Release 4. So these are the standards which are recommended, but then these are only recommended, so only guidelines. There is still no legal mandate to use it. Although the Clinical Establishment Act does mention using EHRs, but then, well, being a state subject, not all the states in India have yet adopted it. So it's a long way to go. Look at the other way, which is unifying digital health or Ayushman Bharat Digital Mission. They are following National Digital Health Blueprint, so they are insisting on standards. But again, as I said, we have a long way to go. We are still digitally not capturing the data in the proper way so that we can really make it seamless.
That was enlightening, sir. As the former leader of the Center for Health Informatics at the National Health Portal, what key initiatives or projects have you been involved in to promote the integration of digital health solutions?
Well, that's actually a pretty long history. Long history in the sense that it all started way back. I mean, during 2009-10 actually, if you remember, there was a National Knowledge Commission during 2006-7, headed by Dr. Sam Pitroda. And they had given some recommendations, one of which was forming the National Health Portal. So a task force was formed for formulating the detailed project report. That was during 2009-10. However, as things happen in the government, things move quite slowly. So finally, when it was decided to have the National Health Portal under the Ministry of Health and Family Welfare, and I joined as the first project director for the Center for Health Informatics of the National Health Portal under the ministry. That was in January 2013. Now, National Health Portal was our primary objective, but then we were very keen to actually get in e-health, digital health in India. So, when a new government came in 2014, after that, in fact, the e-health division of the family welfare was formed, and we were very instrumental in getting e-health policies in place. Even before that, actually, as I said, I mean, this EHR standards also, the committee first started in 2010. So the first EHR guidelines recommendations that came out in August 2013, the work had actually started in 2010, and then it was sleeping for a long time. Finally, in August 2013, it was published. And then, as I said, I mean, we had an e-health division formed in the Ministry of Health, and then lots of these initiatives got into place. And then one of the things which happened during this period, this medical devices regulations 2017 came out. So in that we had introduced software as a medical device. In fact, in our law it was acted before even advanced countries like the USA did it. Then the other things which we were planning, we had decided to form a National E-Health Authority. Later the name was changed to National Digital Health Authority, and this was included in the third edition of the National Health Policy that came out in February 2017. Another thing parallelly that was going on was we were developing some core curriculum for health information management that we did in 2015-16. Curriculum is still available on the ministry website. And subsequently, in 2021, the National Commission for Allied Health Professionals was formed. The act was passed. Of course, right now, an interim commission is working. So once it is fully set up, I think we'll have very clear-cut guidelines, because under the National Commission for Allied Health Professions, there are 10 commissions, there are 10 councils, and the 10th council is the National Council for Health Information Management and Health Information Professionals. So once we have that in place, probably we have more streamlined academic curricula and other activities. But the thing right now, which is really spearheading the digital health in India, is the Ayushman Bharat Digital Mission.
Okay, sir. Thank you. As the co-chair of the task force on artificial intelligence for healthcare, what opportunities and challenges do you see in implementing AI solutions in the healthcare sector, particularly in the context of diverse global standards?
Actually, this is, something which is very difficult to answer just on the face value, but still I'll just say. So, in fact, for this AI guidelines, if you look at the healthcare, so the Indian Council of Medical Research also brought out an ethical guidelines for application of artificial intelligence in biomedical research in healthcare. Then the National Academy of Medical Sciences India and the DGHS, along with the MOHMW, we brought out a report of the task force of artificial intelligence healthcare. Both the things happened in 2023 only. So I was a co-chair of this task force in National Academy of Medical Sciences, and what we really wanted to see is, just before I go into the NAMS guidelines, the ICMR guidelines, in the applications, it talked about diagnostics and screening, therapeutics, drug discovery and development, clinical care, epidemiology and prevention of disease, behavioral and mental health care, health management systems using AI, That was again divided into two parts: medical AI software for clinic management systems and medical AI software for hospital management systems. Then they had a section on ethical principles of healthcare. Then another section on guiding principles for stakeholders involved in development, validation, and deployment. Then the ethical review procedures in medical AI and informed consent process. Governance of AI technology used for healthcare research. So that is what the ICMR came out with. In NAMS, what we tried to do, we first talked about the need for AI in healthcare, then more the AI applications in health and medicines. Then we took a specific discipline, digital pathology. What are the AI applications there? Of course, what are the challenges of AI in healthcare, challenges with AI in digital pathology? Then we discussed some of the use cases, technology initiatives, policy and regulation around AI, and of course, privacy is always a concern. So then we looked at the current situation in the country, the implementation status, challenges, how they can be overcome. Then for the recommendations, we had a vision. We had the issues or the gaps identified in the current situation in the country in context of the problem or health issue. We made the recommendations to bridge the critical gaps or deficiencies in this aspect. We tried to recommend based on short-term, medium-term, and long-term, what are the suggested policy activities and advocacy, then what are the recommendations for health and medical professionals. So coming back to your question, what were the main challenges? The most important one is lack of data in ready-to-use form. We still don't have it. I mean, we may have some data on paper, but that is not digitized. Just scanning a PDF document doesn't help, because if we enter the data in digital format, it's easier to retrieve, it's easier to analyze. Then second problem is the inadequate infrastructure and connectivity, particularly in rural areas. Then of course, lack of regulation and governance, how they should be used. Although there are now rules coming up and there's a lot of talk going on globally about regulation for AI. But there's a huge potential there. Then the most lack of skills due to shortage of skilled personnel to build and deploy AI solutions. And of course, adequate and timely funding and investment that can limit all the development and deployment, and ethical and social concerns will always be there. So, because it does impact on jobs, privacy, quality. However, all these challenges notwithstanding, there is a growing recognition of the need to overcome these, which has political will and vision to realize the potential of this technology. So, the guidelines and the recommendations, our vision was that consensus should be achieved among the various stakeholders in the health of India towards a national vision. That is an open attitude towards judiciously using AI for healthcare. So, the National Academy of Medical Sciences approach will ensure a digital technology adaptive population and an AI-enabled healthcare system through standardized, evolving evidence-based guidelines to deliver sustainable, high-quality, and affordable patient-focused care. Further to the National Health Policy 2017, the goal of AI-enabled healthcare system and digital technology adaptive population being proposed by the National Academy of Medical Sciences is for attainment of the highest possible levels of health and well-being for all at all ages through a preventive and promotive healthcare orientation and universal access to good quality healthcare services without anyone having to face financial hardship as a consequence by adding AI-enabled healthcare among the other initiatives of the Government of India. So, in the way forward, what we said, short term, we need to identify the areas within healthcare where strategies are not effective, and integration and complex analysis of novel structured data are necessary to make accurate predictions. Then automation of routine administrative tasks to enhance workflow and save costs. We need to identify the existing challenges and explore solutions for enhanced assessment and adoption of technology in the real world environment. Different stakeholders have adopted different interpretation of digitizing records. There needs to be a guiding document that erases ambiguity from these technologies. There is an urgent need for an integrated technology solution that is interoperable, scalable, and affordable. Adoption of a cloud-based health management system can reduce the challenges arising from bureaucracy and red tape of operational costs. In the medium term, what we envisaged is that data entry into the electronic medical record (EMR) systems can be automated by use of technologies like ambient AI, IoT, or Internet of Things, and 5G technologies. In order to promote coordination between academia, government, industry, NGOs, and patient advocacy groups, the government must also invest in and create public-private partnerships across the healthcare sector. Then evidence generation, adoption, and full integration of solutions need to be incentivized. Scaling up frameworks will ensure adequate protection of privacy and critical will be made on sustainable data pipelines and infrastructure design and processes as well as innovative business models. For the long-term goals, what we said that we should have an entire department dedicated towards clinical artificial intelligence in each health facility or in each region may be considered in the future. As an option, instead of working in silos, a multidisciplinary group involving all stakeholders like administration, technology, clinical staff is recommended. Then data stewardship is essential to build and trust and long-term integration of AI into India's healthcare system. Of course, here the role of digital literacy and health literacy, so digital health literacy, health data literacy, these are very important. Implement new AI tools alongside existing tools so that practitioners can feel comfortable with the new tools and workflows and experience their added value in practice firsthand by leveraging further research studies on clinical evidence, benefits, and AI. So these were the recommendations in general, what we had proposed in the NAMS guidelines.
Okay. With every challenge, I think there is a new opportunity coming up. I hope we will be able to convert every challenge into that opportunity. How can countries, especially developing ones, leverage digital health standards to enhance their healthcare systems and improve overall public health outcomes?
See, I mean, what is standards? I mean, here, as I said, I gave the example of the adapter. Now, if you think in terms of, suppose you are storing the data in a hospital. So, say hospital A stores male is equal to 0 and female is equal to 1. Now, hospital B stores male is 1 and female is 0. That's the opposite. Then hospital C stores there could be male, female, unknown. So, there are 3 genders, MFU. You cannot really transmit the data straight away because if you transmit the values, so male in one hospital becomes female in another, which doesn't serve the purpose. But if you use a standard like HL7, where it goes through it's like an envelope. It codes it. It doesn't send a 0 or 1. It sends the data, gender male or gender female or gender unknown, like that. So that is the purpose of interoperability. Standards ensure that. Now, standards, once it is used, it doesn't matter, you don't have to change your own database system, whatever you're using. If you're using a standards-enabled system, when you exchange the health information across the different systems throughout the country or even globally, then there's no ambiguity anywhere. Same with the clinical terms, say whether you say CA larynx or laryngeal carcinoma or laryngeal malignancy means the same, but different doctors use the different terms for the same thing. So if you are trying to send this and then there are language barriers also, that make a confusion. But if you are sending in standards like it's a SNOMED city enabled system, there's a unique code for this. So irrespective of what language you use, what natural language you are using, what terms you are using, the code is the same. So when it goes to that end, they can read that code, whichever name they prefer. So there's a preferred name and alternative names and everything like that. So standards ensure that not just only the structure of the data, the syntax, but also the meaning, semantics. And that is very essential. So once we have this, then we can have a seamless flow of information across the world. That is what's the purpose of standards. And of course, standards are being encouraged by the government. However, I mean, implementing standards, for using SNOMED, you need a EMR system in place. If there's no EMR, you can't use SNOMED. Like ICD, you can have the manual codes, you can memorize the codes, and many people actually memorize the codes and write the codes even without thinking. But that's not the purpose. Like SNOMED City, the code is not supposed to be memorized. I mean, it's a machine readable number and a random number. It doesn't mean anything. But once it goes, if it's there in the back end, then as I said, there's no ambiguity in the health information that is being exchanged anywhere.
That's very interesting, sir. Given the rapid evolution of technology, what ethical considerations do you believe are crucial when implementing AI and other digital solutions in patient care?
Yeah, I think this ethical issue is very important. In fact, I have a few publications on this also. I can send the links if you want. They're all open access. So, I mean, where do we need ethical things? I mean, well, we need it for training the faculties. This is the human resources. Then we need to train them who are developing it, that what you do should be useful rather than harmful. Then not just developing once you are using, because AI is nothing but a tool. It's a technology tool. It's like a knife. Whether you use it for cutting vegetables or cutting human beings, that's up to you. You can't say that, oh, why is the knife doing this instead of that? It's not like that. So if the tool is there, it may or may not be used for a good purpose or a bad purpose. It's difficult to really control. In fact, that's why while the AI regulations, all the countries now, EU has already come up with one that all the countries are trying. Even India is very much at the forefront. But regulating is not that easy. I mean, the best way for regulation is stopping it altogether, but then that won't help anyone. And we can't really stop the progress of technologies. The technology is going to advance. But of course, we have to be very careful that what we develop is like, I mean, if you are using it for a clinical decision support system, I mean, it's more as an aid rather than the final decision. But technology may or may not also sometimes go wrong. So whether you look at the driverless cars or the automated robots for surgery, it can happen, accidents do happen. So we have to be very careful. We have to make sure that things can be controlled if it goes beyond our control. I think there are lots of films coming out on those areas, and some are quite informative, and it may look comical, but then some of the things could actually happen. So we have to be very careful. We have to be socially responsible. Otherwise, as I said, I mean, it's a tool. Tool can be used for any purpose.
Yes, sir. So, in the light of recently enacted Personal Digital Data Protection Act, can we say that the insecurities and confusions regarding breach of privacy and confidentiality has been dealt with?
Actually, as I said earlier also, and I repeat, I mean, the National Health Policy 2017 was the third edition of our national policy. If you remember, the first edition came out way back in 87. The second edition came 15 years later in 2002. The third edition came another 15 years later in 2017. In the 2017, or the third edition of the National Health Policy, we had said that there would be a National Digital Health Authority that will really guide all these things. However, in fact, for this a bill was drafted, and I was a part of that. And the National Law School, India University of Bangalore, along with the Ministry of Health and Family Welfare, Government of India, we had done a lot of meeting, a lot of brainstorming. In fact, they had an internal committee which was headed by a retired Chief Justice of India, like that. So a lot of hard work had gone on, and we had put this, we had called this DISHA, the Digital Information Security and Healthcare Act. So this DISHA bill 2018 was put in the public domain for comments, but subsequently it was withdrawn in favor of the B.N. Sri Krishna Commission report, which was metamorphosed into the Personal Data Protection Bill 2019, or PDP bill. Then it went to the Joint Parliamentary Committee after being placed in the Parliament, and then it was revised into the Data Protection Bill 2021. Then even that was withdrawn, and again a fresh bill was placed in 2022, the DPDP bill, and that was finally enacted. Now a law of the Digital Personal Data Protection Act, DPDP Act 2020, August 2020. So this covers all the areas, including digital data under its purview. However, I mean, we have to wait and watch, because see, there are lots of provisions regarding the data fiduciaries, I mean, who are responsible for maintenance of data. The query which comes in, like in healthcare, often you need to have emergency measures where you can't wait for the consent. That may take away your life. So how do you break the ceiling or break the glass ceiling? That's the query. And again, how much of the data can be shared? Now, the patient is the owner of the data. The patient can say, I'm not going to share this data with that doctor or this doctor. But then a doctor who's treating a particular disease may actually need information about the other systems of the body. So you cannot just say, the patient can decide what data can be shared, what cannot be. So there are lots of issues which are very specific to healthcare that needs to be addressed minutely, and we have to just wait and watch and see how does this law help in those situations. So you have to wait and watch. That's what I can say. But yes, the law is quite extensive. It covers a lot of things, but a lot of questions are also which are yet to be answered.
Yes, definitely, sir. I believe one of the exclusions to the provisions of DPDP Act was startup companies. Do you think this is a potential loophole in data security?
No, there's actually basically no exclusion like that, startup or individual, because it's all either you are a data provider or a data user. So, in fact, the startups can fall in either category. So it's not that any particular category is excluded. No one is excluded. I mean, any digital data will come under its purview. But as I said, when it comes to healthcare, there are lots of issues which are not explicitly covered by the law. So that, as I said, if and when the cases arise in the various courts, then probably these would be decided. I mean, finally, we may get also some guidelines from the Supreme Court or whatever it is. But as and when it arises, because there are lots of issues which have not been answered. And if we had a specific Digital Information Security for Healthcare Act, that would have answered all these specific questions, because the bill that we had drafted in 2018 had all those use cases described, which needs to be explicitly stated. Otherwise, I mean, of course, once the DPDP authority is informed, and once that becomes fully functional, they will also set the rules. So hopefully, when those rules for healthcare will have those provisions, we have to wait and watch it, how it shapes up.
That's very informative, sir. I hope that gives our listeners a favorable perspective on applications of AI in healthcare. What advice do you have for individuals aspiring to enter the field of health informatics, especially those interested in contributing to the development and implementation of digital health technologies?
Okay, answer both to this as well, partly to the previous question also. In fact, for the startups, I don't know if people are aware, but there is actually a very good thing, this ABDM, the Ayushman Bharat Digital Mission, they have a sandbox. The URL is sandbox.abdm.gov.in. So sandbox.abdm.gov.in. So if you go for the ABDM sandbox, so whether it's an individual, whether it's a startup, whether it's a multinational company, anyone can enroll for the sandbox and try their solutions, try their applications, how it would work in the ABDM environment or the National Digital Health Environment of India. So who can enroll for the sandbox? It could be the existing providers of payers, that is the insurance companies or individuals, by existing ABDM partners, or healthcare service providers. So it could be hospitals, it could be doctors, for healthcare facility providers. So as I said, both the hospitals, doctors, as well as here the healthcare vendors, and everyone can register in the sandbox and they can try to find out what are the things. Now, if we come to the career prospects. So career prospects, for that we need to just say a few things. Like, if you look at the evolution of computers in the 60s and 80s, up to the 80s, we had the mainframes and the personal computers. That was the age of industrial automation. In the next phase, it's the 1990s to 2000s, we got the client server and the internet became a mainstream. So we went into the business process automation. Then in the 2000 to 2010, the cloud, mobile, data, all these things came into being. So what we are looking at is the digital transformation. And 2010 onwards, we are getting into the intelligent technologies, intelligent enterprise. So artificial intelligence, machine learning, Internet of Things, distributed computing like blockchain, all these things are there. So if we look at healthcare, how has it affected healthcare? So initially we had patient diagnosis and treatment. That is what the traditional healthcare modern medicine has been. Then what we can call as healthcare 2.0, we got medical equipment and monitoring devices coming into play. That was 60s, 70s, 80s. That went on happening. Then we entered the era of healthcare 3.0. That is when the electronic health record or EHR, computerized provider order entry or CPOE, remote care, telehealth, all these things started being played. And by the turn of the millennium, even in India, we got into the telemedicine and remote care things. Then came the healthcare 4.0, like the fourth industrial revolution. We are looking at healthcare 4.0. This is now what we are getting into smart health, connected care, personalized medicine, artificial intelligence. So here what we are having those wearables, Internet of Things, like Fitbit or Apple Watch and so on. And that is giving us connected care, personalized medicine. The problem is that when a person who's using such devices goes to a doctor, expects the doctor to go through those information and decide the management accordingly. But there's so much of information explosion, and even doctors are not trained which data to take and which not to take. So health data literacy is very much needed to be taught across healthcare professions. Education also needs to look at it. Now, if you come into public health, so health informatics in general, the clinical health informatics talks about individual health issues. We have population informatics, where we have non-health issues for groups, the socioeconomic status, migration, education, employment, all these matter. Public health informatics is a superset of both of these things. So we have individual health issues and non-health issues, migration, education, employment. So when we consider both of these things, we get public health informatics. That means health issues for the groups, communities, or whatever we call it. Now, if we go into the effects, so when we talk artificial intelligence in healthcare, what is it? AI in healthcare is an umbrella term to describe the application of machine learning algorithms and other cognitive technologies in medical settings. In the simplest sense, AI is when computers and other machines mimic human cognition and are capable of learning, thinking, and making decisions or taking action. So, now, if you look at it, what are the career options? As I said, something which is very much required. First is the digital literacy, that is the individual's ability to find, evaluate, compose clear information through writing and other media on various digital platforms. And then data literacy, that means the ability to collect, manage, evaluate, and apply data in a critical manner. The critical manner is the key word. Another way to put it is the ability to read, work with, analyze, and argue with data. So when we apply it to health or healthcare, we call it health data literacy. And digital health literacy is digital literacy plus health data literacy combined. So if you look at the National Medical Commission, the competencies for the medical graduate. In fact, the erstwhile Medical Council of India had brought out this CBAB, Competence-Based Undergraduate Curriculum for Indian Medical Graduate, in 2018, where one of the goals for the learner, the Indian medical graduate learner, includes the section is 2.3.2. The Indian medical graduate has to be a leader and member of the healthcare team and system with capabilities to collect, analyze, synthesize, and communicate health data appropriately. This is what is talking about health data literacy. That's what's required. But of course, we don't have any explicit curricular guidelines for that. Then the other happening, which I said, the National Commission for Allied and Healthcare Professions Act was passed in 2021. An interim commission is working, but we will definitely hope to get the proper commission soon. Under this commission, there are 10 councils. The 10th one is the National Council for Health Information Management and Health Informatics Profession. So, what does it say? The Health and Information Management Professional is the person who develops, implements, and assesses the health record processing, storage, and retrieval systems of medical facilities and other healthcare settings to meet the legal, professional, ethical requirements. So, it could be a health information management professional, including medical records analyst, that could be a health information management technologist. So, now one of the things which often people ask, that which one is superior? Is the brain superior or the computer superior? Now, brain plus computer, if you use both together, that is much better than either alone. So what the human brain can do alone or what a computer can do alone, if the two come together, the output is much better. So the next obvious question comes is, will AI replace a doctor? The answer is no. It's an emphatic no. But doctors not using AI will definitely be replaced by doctors using AI. In other words, for any doctor or any healthcare professional, public health or otherwise, to stay in the field, we have to adapt to the AI-enabled technologies which are coming there to help us, to assist us, to guide us, to take us to further levels. And opportunities are growing every day. But as I said, I mean, it's not going to replace us, but it's definitely going to replace us if we don't use this.
Thank you, sir. That was a very detailed outlook. Last question. Can you share a success story from your experience where the application of digital health and AI has significantly improved healthcare outcomes or efficiency?
Yeah, I mean, I have been working on AI for a pretty long time. In fact, I had done PhD also on a clinical decision support system. Then when I was with the Amrita group, I had done some work. In fact, one student from Bharatiya University was doing her MSc dissertation in bioinformatics, and in fact, she got the gold medal also from the university. So we had been working on inborn errors of metabolism, and we could actually classify them. I mean, what's the problem? The inborn errors of metabolism or inborn metabolic disorders. There are many enzymes involved, and it's very difficult to clinically distinguish which enzyme is responsible for the problem with this particular child. So we did develop a system that was way back in 2006, almost 17, 18 years back. And that time what we found was very interesting. Of course, unfortunately, I couldn't follow it up because I have always been moving from different places and the other collaborators also moved away. So there have been subsequently a lot of things. As I said, we introduced software as medical device in the law as a law of India. And in fact, Google, or rather Alphabet, has really come out with a lot of applications. In fact, they have collected the data from India only. So Shankar Nethralaya, Arvind Group of Hospitals, the LV Prasad Institute, and from there they collected those retinal, those ophthalmoscopic data. And then based on that, they can predict on the heart conditions and so on. A lot of work, and in fact, many of these software as medical devices have been approved by the US FDA. In India, we still don't have any formally approved software as medical device, but a lot of things are happening, growing. I am involved with a few of them. So we look at the official projections. So Niti Aayog has actually come out with a report in June 2023. So the Niti Aayog says that the AI in healthcare market is projected to grow from $14.6 billion in 2023 to $102.7 billion by 2028. So more than 7 times in 5 years. So the report on the National Strategy for Artificial Intelligence, Niti Aayog has shown the report on National Strategy for Artificial Intelligence. They have actually showed that shortage of qualified healthcare professionals and non-uniform accessibility to healthcare across the country prevails. So definitely the ministry is also looking at it. If you look at the success stories of digital health in India, I think the CoWIN application is an excellent application. In fact, we have digitally given the COVID vaccination certificates. You can scan the QR code, which many advanced countries also didn't give. The advanced countries were giving handwritten certificates. Then if you look at the vaccination, the EVIN network, then of course ABTM itself is there. So there are a lot of success stories which are going on there. Now, if you look at some of the AI healthcare startups in India, so India's startup ecosystem has been instrumental in driving AI innovation. Companies like Zebra Medical Vision, Niramay, and Sigtuple, they are the pioneering AI-driven solutions in healthcare. So in India, we are also getting some others like UiPath and Automation Anywhere, who are at the forefront of robotic process automation. And these things are being encouraged by the government of India. In fact, India is also leading this coalition formation on AI governance factors, and in fact, a lot of activities are just around the corner. Maybe I would also be involved with some of them in the near future. But essentially, what is there that it's a ever expanding field, it's a growing field, and as I just know, that anyone who's not going to use this AI-enabled technologies would be the losers. They would be losing out. In fact, it is something that's inevitable. It's better to be prepared for the inevitable. It's better to embrace the technologies as they advance. Of course, with the caveat, we have to be ethical. We have to look at the societal concerns and act accordingly. It's a long way to go. It's an interesting journey ahead. AI is nothing new. The term artificial intelligence or AI was coined before I was born. That was in 1956, or 70 years back. So AI is, but applications now are becoming more accessible, more affordable, and healthcare is probably the least touched yet. If you look at many other industries, AI is doing a great job. Nothing to be worried, but yes, we have to keep our eyes wide open, embrace technologies, and encourage others, and of course, ensure the safety. Safety is always first.
Thank you, sir. Thank you so much. This conversation has been truly captivating. I believe our audience find it as intriguing as I did. Thank you for graciously allocating time from your hectic schedule for this episode. Thank you so much, sir.